Hello everyone, Dr. Obeng-Frimpong here again, and welcome to Med News, an extension of the Tutor Med channel where we redefine medical education. Today is 28th July, and that is World Hepatitis B Day. And so in this video, we want to share some facts about hepatitis B infection, and so kindly stay tuned. World Hepatitis B Day is celebrated annually on 28th of July. Why 28th of July? Now this man here is Dr. Baruch Samuel Bloomberg, an American physician. And he was born on the 28th of July. And so why is World Hepatitis B Day celebrated on Bloomberg's birthday? It is because Dr. Bloomberg discovered the hepatitis B virus in 1967 and then developed the vaccine in 1969. And so, to honor this achievement, World Hepatitis B Day is always celebrated on his birthday. The hepatitis B virus is a double-stranded DNA virus which causes liver infection. When the virus infects the liver, it leads to inflammation of the liver, a condition known as hepatitis. Now, this hepatitis can be grouped into two. We have acute hepatitis B infection and then chronic hepatitis B infection. And so these two are differentiated by the duration of the infection in the liver. And so using an arbitrary timeline, usually 6 months, as the dividing line, acute hepatitis B infection usually lasts for less than 6 months, and then chronic hepatitis B infection lasts for 6 months and beyond. Now let's look at some interesting facts about the hepatitis B virus infection you probably didn't know. Now, did you know that hepatitis B virus infection is 100 times more infectious than HIV and AIDS? The likelihood of contracting hepatitis B virus infection from an infected individual is 100 times more than contracting HIV virus from an infected HIV or from an HIV infected individual. Another interesting fact is that over 2 billion people have past or current infection, and so the virus is very active among the population or among the world population. Also, did you know that almost 3,000 people die from hepatitis B and C each day? This stats is not only about hepatitis B, but hepatitis B and C. Each day, 3,000 people die from that. And more interesting is the fact that every 30 seconds, someone loses their life to hepatitis B. And so you would agree with me that based on these facts, hepatitis B virus infection is a serious medical condition you and I need to talk about. Wow. Hepatitis B virus infection is more infectious than HIV and AIDS. In fact, 100 times more infectious than HIV and AIDS. And so you would agree with me that we need to know the modes of transmission, isn't it? Well, and so for the modes of transmission, the most common route is from mother to child, what is known as vertical transmission. And so here you have a mother who has hepatitis B virus infection and then gets pregnant. The mother can transmit this virus to the child. And whenever the child gets the infection, about 90% of them would have chronic hepatitis, and that has no cure at the moment. And I should mention that the child gets the infection at the time of delivery in most cases. And so in some few cases, the child can get the infection whilst in the mother's womb. And in some very few cases, very few cases or rare cases, the child can get the infection or may get the infection during breastfeeding. but most of the vertical transmissions occur at the time of delivery, either via spontaneous vaginal delivery or via cesarean delivery. Now, for those who don't get the infection from their mothers, they may get the infection by using contaminated needles. Using a needle which has been infected with hepatitis B virus, and then engaging in sexual contact, unprotected sexual contact with someone who has hepatitis B virus infection, or getting exposed to hepatitis B infected blood during transfusion, to mention a few. Now, on this slide, I need to make a distinction between or among exposure, infection, and then disease, because the fact that somebody or an individual has chronic hepatitis B virus infection does not necessarily mean that that individual has chronic liver disease. Now, if you have a baby who is in the womb of a hepatitis B infected mother, that baby at that point is said to have been exposed to hepatitis B, and so we say the baby is a Hep B exposed baby. The baby has not yet had an infection. Okay? Now, when the virus enters the baby's blood and then goes into the liver and starts multiplying in the liver, producing copies of itself, then the baby is said to have an infection. And so exposure is just having the virus circulating in your blood because, you got into contact, appropriate contact with someone with the virus. The fact that you have an exposure doesn't mean you have an infection. You only have an established infection when the virus starts multiplying in the liver, producing copies of itself. Then we say the patient has a disease when the infection has persisted so long a time that it has resulted in a disruption in the organ's anatomy and function. And so when that happens, then we see that you have a disease. And so it is possible for a patient to have chronic hepatitis B without chronic liver disease. Having said that, it means someone can have chronic hepatitis B infection and would not have the disease. But once he starts showing symptoms and signs suggestive of liver dysfunction, then he has a disease. Sometimes they may not show symptoms and signs, but when we do liver function tests, we would see or would have evidence that the liver is persistently getting damaged, evidenced by a persistently elevated ALT. Or sometimes you may find a cancerous lesion within the liver that is also suggestive of a chronic liver disease. And so, to summarize this slide, a baby who is exposed does not necessarily have the disease. That is why we can vaccinate babies of hepatitis B infected mothers, and then they can live their lives and would not have the infection because they were just exposed. But once they get the infection at the time of birth, said that the hepatitis B virus is now multiplying in the liver, then these babies have the viral infection. And with time, the viral infection may continue to a point that would result in disruption in the liver's anatomy and function, and that is a chronic liver disease. And so, what are the clinical features of a patient with chronic hepatitis B viral infection? The first thing I want to say here is that most patients with chronic hepatitis B infection are usually not symptomatic. They don't have any symptoms. A few of them may have non-specific symptoms like malaise, that is feeling of unwellness, anorexia, they've lost appetite, or fatigue, they easily get tired. But these symptoms are not really specific to hepatitis B infection. They may occur in infections like malaria and others. But a lot of patients with chronic hepatitis B infection are not symptomatic, and so usually they are walking with the infection and they do not know they have the infection. The symptoms or the clinical features usually begin when there is decompensated liver cirrhosis. We will look at this concept in the next slide. Now let's explain what we mean by decompensated liver cirrhosis. This is the healthy liver, or this is how the healthy liver should look like. Now, assuming someone's liver has been infected with this virus, HepatitisB virus, it first goes through a state of acute infection. And then if the infection was acquired during adulthood, about 90% of cases, the infection would resolve. But if it was acquired during infancy, like we discussed earlier on, this infection would progress to a chronic infection. And so the liver is thrown into a state of chronic inflammation. Now, during the chronic inflammation, the liver cells have to heal by fibrosis, and so the parenchymal cells are replaced by scar tissue instead of being replaced by the liver cells, the original liver cells. And this is called hepatic fibrosis, scarring of the liver. Now, the hepatic fibrosis or scarring, after it has persisted for a while, will disrupt the normal liver architecture and function, and then will be characterized by regenerative nodules. And when this happens, we see the patient's liver has become cirrhotic, as evidenced by this liver. Compare this to the original. Now, in the state of the cirrhosis, some viable liver parenchymal cells, it means that not all the liver cells have been replaced by scar tissue. So some viable liver parenchymal cells are able to still perform the functions of the liver despite the presence of the cirrhosis. And so in these patients, there are no signs and symptoms. Patients with this kind of cirrhosis are described as having compensated cirrhosis. It means that the remaining viable liver cells are able to perform the functions of those which have been replaced by fibrous tissue, and so the liver is still able to function as though it were intact entirely, but that is not the case. There is cirrhosis, but it is a compensated cirrhosis. Now the opposite is that when the residual liver cells are unable to perform functions to meet, or they are unable to perform the functions of those which are gone together with what they are supposed to do, then we say that there is decompensation, and so there is decompensated cirrhosis. And it is at this point that the patient starts showing signs and symptoms which are relatively specific to liver dysfunction. And so what are some of the clinical features that may suggest a possible decompensated cirrhosis from chronic hepatitis B infection? Now, this is related to the various functions that are performed by the liver. And so one of the liver's function is to conjugate bilirubin and excrete them through the biliary system. And so if you have that dysfunction, then there will be a build-up of bilirubin, and that would cause jaundice, yellowing of the eyes. Then another thing that can happen is abdominal distension. So the patient will be complaining of a progressively distended abdomen, which doctors term as ascites. There might also be a bilateral leg swelling, that is pedal edema, and sometimes a complication called portal hypertension can occur, and that will lead to vomiting of blood or blood mixed with the stool, known as melena, so hematemesis or melena. The liver again is responsible for metabolizing estrogens. Estrogens are the hormones responsible for the female secondary sexual characteristics. So the fact that the patient has, a female has breasts, more breast tissue compared to a male, is because of estrogens. And so since the liver cannot metabolize estrogens, the estrogens will build up in men, and the men will start having enlarged palpable breast tissue, a condition known as gynecomastia. And so this is just to mention a few of the clinical features of decompensated cirrhosis. Now on this slide, I'm just going to run through the complications, the various complications of cirrhosis. So the first I would want to mention is portal hypertension. And so the cirrhosis disrupts the liver architecture, that the scar tissue starts compressing on the portal channels or blood channels in the liver. And so that leads to conditions like variceal bleeding or variceal hemorrhage. So you have esophageal varice, which is bleeding, or anorectal varice, which is bleeding. The portal hypertension might lead to ascites. One of the contributing mechanisms to the ascites is also a low albumin level in the blood because the liver is down. Then the ascites can be infected with bacteria, and that will result in spontaneous bacterial peritonitis. Sometimes, because of the portal hypertension, there is a widespread vasodilatation because of production of excessive nitrous or nitric oxide, and then this vasodilatation would lead to decreased renal perfusion, and that will result in hepatorenal syndrome. Then sometimes you may have hepatic hydrothorax, where the fluid sometimes move into the right pleural space. You may have hepatopulmonary syndrome and then portopulmonary syndrome, just to run through them. Two other resulting complications from the portal hypertension is having portal hypertensive gastropathy, and so you have gastric mucosal wall problems because of the portal hypertension, and sometimes you may have cirrhotic cardiomyopathy, heart failure as a result of liver cirrhosis. Then apart from portal hypertension, another thing that can occur is hepatic encephalopathy, that is brain dysfunction or a neuropsychiatric problem because of an underlying liver disease. And so you have ammonia building up in the brain and causing various neuropsychiatric problems like abnormal behavior, agitation, seizures, coma. Sometimes the hepatic cirrhosis can lead to liver cancer, that is hepatic carcinoma. It is worth mentioning that there are various causes of hepatic carcinoma, and all those causes need the liver to be cirrhotic before they progress to hepatic carcinoma. However, Hep B, in its dangerous ways, can even give you hepatic cancer or liver cancer without the liver even undergoing or going through cirrhosis. Very important to note. And so you may have a hepatoma or a hepatic carcinoma on top of a normal liver. Then another complication is having portal vein thrombosis. Okay, so blood may clot within the portal vein, and then that might lead to other complications like Bad-Chiari syndrome. Now on this slide, let me go through a few of the relevant investigations we need to do for a patient we are suspecting of having hepatitis B infection. And so what we do is to screen the patient first of all. So we use the hepatitis B surface antigen to screen the patient for hepatitis B, and if it is positive, we go ahead to do the hepatitis B serology or profile to see if the patient has an actively replicating hepatitis B viral infection and whether or not it is an acute or whether it's chronic or an acute infection. I wanted to say they want to test the liver's function. So we want to do a liver function test looking for an elevated ALT. If it's persistently elevated, that may be an indication to start treatment together with other relevant labs we will look at later. Then we want to scan or do imaging of the liver. We are looking for evidence of cirrhosis, whether there is hepatoma. The ultrasound scan may tell us if there is portal venous thrombosis. It may tell us whether there is ascites or fluid accumulation. Then we also want to do alpha-fetoprotein. It is a tumor marker we use to monitor the occurrence of or the possible occurrence of hepatoma. Then we want to do a full blood count. The full blood count may show thrombocytopenia or low platelets. And then if there is thrombocytopenia in the setting of an enlarged spleen, splenomegaly, which is itself a manifestation of portal hypertension, then we know that the hypersplenism or the splenomegaly is responsible for the thrombocytopenia. Sometimes the thrombocytopenia may also be as a result of decreased thrombopoietin. The liver is supposed to help in platelet production, and so if it is destroyed, then platelet might also go down. Indeed, we are also looking for HB level. If there is anemia, we may have to investigate if the patient is having bleeding or variceal hemorrhage. Then we want to do a BUE creatinine because of the risk of hepatorenal syndrome as a complication. And then for some patients, we need to start them on treatment, and we need a normally functioning kidney to be able to start the full dose of tenofovir, which happens to be the drug of choice or the first line of choice. Then aside that, we also want to screen the patient for other insults that may happen to the liver, like hepatitis C infection. We want to screen for retro, among others. So just to mention a few. Now, regarding the treatment of chronic hepatitis B infection, I wouldn't want to go through the various guidelines, but I would want to say that the treatment, whether or not a patient will be put on hepatitis B treatment, depends on the hepatitis B profile, whether the virus is actively replicating or it is dormant. It will also depend on the amount of virus in the patient's blood, so the viral load, and then also will depend on whether the ALT levels are very increased or not, and also whether there is presence or absence of cirrhosis. So clinicians use these guiding principles to determine whether we should start a patient on hepatitis B treatment or not. And then technically, usually the drug of choice, like I mentioned in the previous slide, is tenofovir. And then if tenofovir is not available, we may use entecavir. But entecavir, according to the WHO guidelines, should be used for children. Yes. Very good. And so how do we prevent this deadly or potentially fatal disease? Vaccination or immunization remains the primary and most effective way of preventing the disease or the infection. Usually we give 3 doses, or 3 doses are given, usually given at the first time you take the vaccine, and then the next month or 1 month later, and then on the 6th month. Now, initially, it was thought that this schedule should be strictly followed, and that if anyone missed the schedule, he should restart everything. But current evidence from up to date, the world's most recognized medical reference text, says that an interruption in the vaccination schedule does not require restarting the entire vaccination or adding extra dose. And so, for example, if someone gets his first dose, according to the schedule, he's supposed to get a second dose at 1 month. If in case he misses the second dose, it is not necessary to start or restart the entire vaccination. You can give the second dose as soon as possible. And then in case he's taking his first dose, second dose, and he's missed the third dose, you can also give it as soon as possible. And then the advice here is that you should give the interval between the second and the third dose should be at least 2 months. What I'm saying is that if the patient has missed his 6th month or his 6th-month dose, you can just give the patient the third dose and then do antibody titers. It is not necessary to restart the entire vaccination schedule because he has missed his vaccination schedule. And so thank you for listening to this facts or this lecture on hepatitis B infection, because this is hepatitis B day. And kindly do not forget to like and share this video. Subscribe to our channel for more simplified videos like this. See you in the next video, and until then, bye.